I'm Ludovic, a French osteopath, and today I'm in Jiva Institute. I've got the chance actually to make an interview with Yogacharya, who give me the sense actually. So namaste Yogacharya.
Namaskar.
And actually I've been practicing in the Jiva Institute some yoga, and I've got some questions to ask you.
Yes,
today.
definitely you can. Why not?
Because actually yoga, when I was in France, when I used to practice some exercise, maybe some exercise, I think it was yoga. Actually, it was not. And
No, how do you say that was not yoga? Do you find any difference when you practice here in Jiva and you practice in France?
yes, because actually yoga, as a Westerner, you can have different kind of view for yogic exercise. Some people think that actually yoga can be like fitness, exercise fitness, only reserved for Indian people. Other people would think also that yoga is kind of strange stuff for contortionists, because you have to make some posture difficult to put your legs upon your head and some difficult postures. And other people also think that yoga is only related to religion. When you say yoga, it's you will do some om and.
It's Ludwig. One thing I tell you that it's a misconception that people think that yoga can be performed only on the top of mountain.
Yeah.
See, and one person sitting on the bank of river and with closed eyes, he thinks that he's doing meditation, but he's wandering. His mind is wandering somewhere. So people see that posture and they think that this is the only yoga. But yoga is a lifestyle.
Okay.
One, you must keep in mind that yoga can give you physically fitness, mental fitness and spiritual fitness. So combination of all these is known as yoga.
Okay.
Yoga means, it comes from the Sanskrit root that yuj. Yuj means union. So union of this mind, body and soul. Or we can say that yoga is a path that can lead us to the union of soul and supreme soul.
Okay. So it's totally different.
Yes, this is totally different. That one should not think that only hard posture and difficult posture is a yoga. Yoga is a very simple way of life. So they can practice this yoga, and yoga can also that can control the fluctuation of mind.
Okay, but actually, what is the difference with fitness? This is a way of life, I've understood that, but what is the difference between some fitness exercise and yogic exercise?
There is lot of difference. There is lot of difference, because when we do this exercise, only when we focus on one part of the body, one part of that muscles, and that also this yogic kriyas, they require only a small place. Exercises, they require a big space, plus they require special type of equipments.
Yeah.
And moreover, only in yogic exercise you can achieve all benefits, because in normal exercises you focus on the physical part only.
Yes.
There is no mental exercise. So here, when you do asanas, you also have control on your breath.
Yeah, that I've noticed actually.
Yes, you have already practiced that.
Yeah.
So in exercise, you can also that after doing exercise, one gets tired.
Yes.
And needs rest. But in this asanas and yogic practice, though you do this vigorous practice, but even after that you feel relaxed.
Yeah.
you get
also.
yes, more energetic, more rest, more calmer mind.
Happy also.
Yes, happiness is also there. So when you have calm mind, then you can concentrate on the things nicely.
Okay.
So these are the difference between yogic exercise and normal exercise. So what would you like? Would you like to do this exercise only or yogic exercise?
I think actually yogic exercise can be good because
Yes,
I've
you
noticed
have the benefit of that exercises also in yogic exercises.
Yeah.
Plus benefit of that mental level also.
Yeah.
Spiritual level, mental level.
Actually, I can feel that there is different levels of working with yogic
Yes.
exercise instead of fitness exercise. And actually, something I wanted to clarify is because in osteopathy, the philosophy of osteopathic medicine, we focus on the lack of mobility in the different part of the body, or also lack of fluids because of any kind of blockage. For example, I've made already the interview with Dr. Chauhan, who spoke about the different doshas and can be kind of blockage
Yes.
with toxins. And actually, in the osteopathic philosophy, which kind of immobility on lack of fluids can lead to further disease.
Different,
actually.
yes.
Do you think
And pain, yes.
Yeah, and pain. And do you think actually yoga can be linked actually because can be linked to osteopathy?
Yes, why not? Because yoga is also based on all the three doshas, that is vata, pitta and kapha. And when you do this asanas, you control your doshas. Vata is also balanced, kapha can be controlled, pitta can be reduced or increased. So that's there are different type of asanas which can be performed for different type of diseases.
Okay.
Because you know that this only that when joint gets stiffed and that body gets pain, it means something wrong with our system, with our digestion system, because this asanas, yoga, take care of our all the systems, respiratory systems, digestive system, and also that our organs get more healthy, strong. So that is the main thing, that when this asana is practiced, one must control and on his breath. Breath is more important, how to breathe in and how to breathe out. So which you don't find in the normal exercise.
Yeah, sure.
Okay.
And
it can be, yes.
it can be linked actually.
Yes, definitely, definitely, because when you do this asana, you get your joints more relaxed, mobility will increase.
Yes. So actually, you have two. I've understood in the first part of the interview, you have spoken about lifestyle, and now you speak about also disease, because in
Yes.
osteopathic surgery, there's a lot of people who are suffering from different kind of pain, and I got some osteopathic treatment to do, but now you are saying that yoga can also help the people not only in the lifestyle part, but also in the therapeutic practice. Yoga as a therapeutic.
Yes, it can be, because there are different type of asanas for different type of disease. So one must first learn these asanas through that from some expert who knows this asanas and yoga theory very well, because that is more important.
Yes.
Because there are asanas that if you have some problem, say you have backache with cervical, and you have also that high blood pressure. So how to perform that asanas, that is more important.
Yeah, can be harmful.
Just yes, just going through the books or just seeing the pictures, one should not practice this.
Yeah, because there are so many details.
It will, yes, there are so many.
Okay.
You have already experienced that how to breathe in, how to breathe out. That is very important.
Yeah. So you were speaking about also like low back pain and cervical pain. So
Yes.
what kind of exercise people can do to either prevent or maybe cure also this kind of pain?
Yes, prevention is always better than cure.
Yeah.
So if somebody has already suffered, so he should do these asanas very gently. And beginner can learn through some expert.
Yeah.
And anybody can do all these asanas. A person after the age of 18 with a healthy body can do any type of asanas.
Okay, so there is no restriction of
There
age
is no
actually.
restrictions.
Okay.
There is no restriction at all.
Also young people can practice.
Yes,
also.
yes, young people. One thing I would like to tell you that a child after the age of 8 or 10 can see asanas and can practice very little bit, but after the age of 18 he can practice any type of asanas.
Okay.
And there is no restrictions.
Mm-hmm.
And for a sick person or person suffering from some disease, he should do some selected asanas.
Yeah. Not the
And
full, you mean?
Yes.
Can be alpha asanas
Yes.
practice.
And yogic kriya also better for that joint pains. Like this, he can do press this and rotate his ankles.
Okay. Oh,
Yes.
this exercise I've made
This
with,
exercise
as a
for
daily
that.
routine actually.
Yes.
To prevent, because you say that
Prevention.
prevention is better. Than
Prevention is better, yes.
curing. Okay.
And for specific,
Mm-hmm.
if you want that for cervical, for backache, there are specific asanas.
Mm-hmm. So actually you think I can advise my patient to do some asanas, which kind of asanas I've learned with you, kind of yogic exercise. I can advise my patient to do as a daily routine.
Definitely, why not? Because by taking medicines, they get relief, definitely. But if they practice all this, then effect of that medicine will be more.
Yeah.
They will get better soon.
And also balanced also the
Yes.
mind and the soul.
So
As you were saying.
that is very important.
Okay.
So they can do asanas, they can do this pranayama, there are some mudras, there are bandha. So this is all combination. So you can tell them that they should practice asanas.
Mm-hmm. So actually, as a conclusion, if you want to make a conclusion of yoga, you can say that actually yoga is also practice for daily routine, lifestyle, like you can see in Ayurveda. Some kind of things
Yes.
you have to do, some diet to follow, for example. And also some part of yoga can be also used as a therapeutic practice. So actually yoga is quite complete.
Yes, yoga is a complete nourishes food. So whosoever eat it will get benefit of that.
Yeah.
It's not a junk.
Yeah.
It's a very nice and very healthy food. And one should take it as a that as this food is very important and necessary for our life. Sleep is also very necessary. So one should make this asanas also a part of his daily life.
Okay. So I would like to thank you for this interview, and I would say namaste, as we say in India.
Namaskar.
Thank you very much.